Is your baby teething and you're unsure of the signs and symptoms? Welcome to the world of babyhood, where teething is an inevitable milestone. It's a fascinating process that typically kicks off anywhere between 4 to 12 months of age, with most babies beginning their teething journey around the 6-month mark. This period can be a bit of a challenge, but don't worry. Understanding the signs of teething can help you better soothe your little one during this challenging time. So, what are the signs that your baby might be teething? It's a question that often leaves parents scratching their heads, but fear not. We're here to help you decipher those telltale signs. The first thing you might notice is your baby's gums becoming sore and red. This is a direct result of those tiny teeth pushing their way to the surface. You may also observe a mild temperature, not exceeding 38 degrees Celsius, which is another common symptom of teething. Flushed cheeks are another sign to look out for, along with a rash on the face. These symptoms can be attributed to the increased blood flow to the area. The discomfort might also prompt your little one to rub their ears more often. This is due to the shared nerve pathways between the jaw and the ears. And let's not forget about excessive dribbling. This is a classic sign, and it's all due to the extra salivation that happens during teething. Your baby might also start gnawing or chewing on things more than usual. This is a natural response, as applying pressure to the gums can help alleviate the discomfort. Lastly, you might notice increased fussiness or difficulty sleeping. Restlessness is quite common, as the discomfort can interfere with their usual sleep patterns. Remember, if you're ever concerned about any symptoms, it's always best to consult a medical professional. Order of teething. But what teeth should you expect to see first? Well, typically, a baby's teething journey begins with the bottom incisors making their debut between 5 to 7 months. They're soon followed by the top incisors, which usually sprout between 6 to 8 months. The first molars are the next in line, generally appearing between 12 to 16 months. By the time your little one is 2 to 3 years old, you can expect them to have all their milk teeth. Now that we know what to look for, let's talk about how to manage these teething symptoms. Managing teething symptoms. Teething can be a tough time for babies, but there are ways to help them through it. The first line of defense against the discomfort of teething is a teething ring. Chilled in the fridge, these rings can provide instant relief to sore gums. However, remember to avoid freezing them, as this could hurt your baby's gums. Also, never tie a teething ring around your baby's neck, as it poses a choking hazard. For babies of 6 months or older, offering healthy teething objects can be a good alternative. Raw fruits and vegetables or soft fruits like melon can serve as natural, nutritious teethers. But avoid rusks with sugar, as it can lead to tooth decay. You might also come across teething gels in the market. Though these gels promise relief, there's less evidence to support their effectiveness. It's always better to consider non-medicated options first. However, if you decide to use teething gels, always consult a pharmacist. Simple painkillers like paracetamol or ibuprofen can be given to babies aged 3 months or older. These can help alleviate the pain and discomfort associated with teething. But remember, never give aspirin to children under 16, and always follow the medicine's instructions. In addition to these measures, there are a few more tricks to comfort your baby. Distracting them with playtime could take their mind off the gum pain. Gently rubbing their gums with a clean finger may also provide some relief. If your baby is experiencing excessive dribbling, a cold, wet cloth can be used to soothe their gums. Make sure to wipe your baby's face after dribbling to prevent a rash. Managing teething symptoms is all about being patient and attentive to your baby's needs. It's a challenging time for them, but with your support, they'll get through it. And don't forget, your baby's first tooth is also a sign that it's time to start thinking about dental care. Dental care for teething babies. Teething also signals the start of your baby's dental care journey. It's essential to register your little one with a dentist as soon as that first tooth peeps through. This early introduction to dental care helps keep those tiny teeth healthy. And speaking of tiny teeth, don't forget to introduce a small amount of fluoride toothpaste when brushing. It's never too early to start good habits. Armed with this information, you're now ready to support your baby through their teething journey. Remember, every child is unique and will experience teething differently. Always consult a medical professional if you have any concerns.